Hi, this is Dr. Thomas Lin. Today I'd like to talk to you about IPLs and lasers. So IPLs is called intense pulse light. This is a wide range of wavelength of light delivered to the targets, as well as lasers, a very specific wavelength of light delivered to the target. So the targets have different chromophores, and these are absorption pigmented, usually pigmented targets of the skin that picks up this energy and essentially either gets destroyed or burned off. So these are three chromophores that are very important for these treatments. Basically, one is melanin chromophore is important for hair removal as well as pigmented lesions. There are also the second one being hemoglobin, which is the blood carrying oxygen carrying capacity of the red cell. The hemoglobin is being present in blood vessels, so this chromophore is important in absorbing the energy and therefore be important for vascular lesions. As well as the third one will be water, obviously very important in the skin, very prevalent thing, and is very important for this chromophore is important for facial rejuvenation. So these selective wavelengths on the laser and the pulse direction as well as the energy that we select can achieve just a very specific chromophore absorption without destruction of other surrounding tissues. That's what we call collateral damage. We'll lessen the collateral damage but want a very specific target to be hit. Essentially, I like to think of it like absorbing something like a colored shirt. A black shirt will absorb that energy from the sun much more readily, and so you will feel much more heated up because of the absorption of that energy. For instance, if you wear a white shirt, that absorption is sort of reflected out, so you're not absorbing that energy. So different absorption of the different molecules that I mentioned is very specifically targeted with lasers. The intense pulse light is not a laser, but it's a broad range of wavelengths that's been shot to the skin, but it can be selectively filtered for different treatments. For instance, there will be the visible spectrum is quite large, wide range, but the 420 would treat a very very superficial and very vascular lesion, as well as some acne lesions, for instance. Pigmented lesions can be targeted by with IPL with another filter. And hair removal, for instance, can use another filter to target the melanin of the skin using the IPL technology. Same thing. The wavelength will probably stand around the 650 to 750 nanometer range, and that can target melanin in the skin. Photofacials can be achieved, like I said, the chromophore will be the water in the skin, and that can be achieved with IPL, as well as something called long pulse lasers. And these long pulse lasers, just in very short, just to give you a nutshell, long pulse lasers is something that has a duration somewhere in the millisecond range, about 10 to 50 milliseconds, instead of these nanosecond technology for a Q-switch laser, like this one. The Q-switch, it will be important for the removal of tattoos, and selecting different wavelength within there's crystals in here that's like the alexandrite and the garnet crystal that will allow me to select which wavelength for which color tattoo. So this laser can effectively remove all tattoo ink, all colors in all skin types safely because of that technology of being the 1064, the 532, and the 735 nanometer wavelength that can selectively that I can select. And obviously the energy can be tailored to the patients according and then dialed up accordingly. This is in a nutshell, the long pulse lasers, just so that it can be also used for a painless hair removal, and in all skin type, versus an IPL will be more safe for a skin type up to a Fitzpatrick 4. That would be safer for an Asian or Hispanic skin, but for a darker skin type, you will probably be more safer to go with a long pulse laser. So this is an introduction to lasers and IPLs, and hope to see you in Anew Laser MD, where we use the newest and advanced equipment to fit your aesthetic goals. Thank you.